The topic is root canals. What is a root canal? Why should I do it? When do we do it? And what are my options? We hear about root canals, and I hear patients get really scared when you say the word root canal. So let's talk a little bit about what the indications might be, and then let's talk about the options. Should I or should I not do it? First of all, root canals are indicated when the nerve of the tooth, the pulp chamber within a tooth, is affected by bacteria. That can happen for a number of reasons. It could be trauma. Maybe there was trauma, something that injured the nerve, and eventually the nerve tissue will die. That's a tissue within the tooth that goes down the root of the tooth. Bacteria then finds its way up in there, and it can start an infection. There can also be tooth decay that occurs. The tooth decay penetrates through the tooth, gets into the nerve. Bacteria then enters and goes down the canal of the tooth. So in essence, every tooth has a nerve in it and canal in it, and that actually has a lot to do with growth and development of the tooth. Over time, it will deposit tooth structure from the root canal to the outside. It'll calcify the tooth. Now, once the nerve is affected, then you have to make a decision. What do you do about it? The nerve is affected, and it's not just going to go away. So we have a couple of ways that we can treat an infected tooth, an infected nerve. In both cases, we're getting rid of the nerve tissue within the tooth. One is you remove the tooth, but obviously that may not be a good solution, because you take the tooth out, now you're missing a tooth. There's a space. You have to look and think about, how do I replace it? The other option is leave a tooth, but only remove the nerve tissue within the tooth, which then is what a root canal is. The tooth is opened, you go into the chamber, down the canal. Of course, this is done with anesthetic, so it doesn't hurt. Everything's removed from within the tooth. The infection is removed, it's sterilized, and then finally it's sealed. So you still have the same tooth, but there's no nerve tissue, no nerve canal within the tooth. Bacteria then doesn't get into the tooth. After that, then you have to restore the tooth. Now, I said another way of removing it would be tooth removal, but if you remove the tooth, you got to weigh the benefits, the pros and the cons in removing the tooth. What happens if you remove it? How do you replace it? Are there options to replace? Absolutely. There's some really awesome options to replace teeth. The thing that you have to do is have a good discussion with your dentist. Make that decision. Do I keep the tooth? Do I remove it? What do I want? What are the pros, the cons? And then weigh it out and see what's going to work best for you.